Welcome and good evening, and thank you for joining the collective for part 3 of our trauma series, Trauma Among African American Children. Tonight's presentation is being hosted by the Collective Group. The Collective is a group of organizations that are comprised of the National Coalition of 100 Black Women, Anne Arundel County Chapter, the Anne Arundel County Chapter of NAACP, the Arundel Bay Area Chapter of Jack and Jill of America, the North Arundel Alumnae Chapter of Delta Sigma Theta Incorporated, Rho Eta Zeta Chapter of Zeta Phi Beta Sorority Incorporated, the Lambda Delta Sigma Alumnae Chapter of Sigma Gamma Rho Sorority Incorporated, and Delta Pi Omega Chapter of Alpha Kappa Alpha Sorority Incorporated. So if you missed our last 2 discussions on Tuesday and Wednesday, you missed some exciting information and great panel discussion on the trauma among African American men and trauma in the African American family. If you missed those, please check out our Facebook pages and you can view the presentation. So tonight's topic, we're going to talk about trauma in the African American children. And this will be streamed on NAACP Facebook, along with all the corresponding organizations' respective Facebooks also. So let me introduce our panel for tonight. Tonight we have Kenyatta Hazelwood, who is a trauma services specialist at Howard University at the Level 1 Trauma Center. And we also have Shannon Martin. She's a director of Health Relief, a primary care facility specializing in substance abuse treatment and childhood trauma. Each panelist will have approximately 10 minutes to speak, and then we'll take Q&A around 8:15, 8:10. And so now, thank you for joining us, and we hope you enjoy this series and this session, the topic tonight. And let me turn it over now to our moderator, Dr. LaFay Marshall.
Good evening. Thank you so much for the welcome. I am Dr. LaFay Marshall. I'm a licensed clinical psychologist in Maryland, DC, Virginia, and Pennsylvania, and a member of Alpha Kappa Alpha Sorority Incorporated. Again, we appreciate you joining us for this very important conversation. I would like to start by having our specialist, the Director of Trauma Services at Howard University, Ms. Hazelwood, present us with some information. Ms. Hazelwood.
Hi, good evening, Dr. Marshall, and good evening to the collective of Arundel County. I'm Kenyatta Hazelwood. I'm a nurse and the director of trauma program here at Howard University Hospital's Level 1 Trauma Center. As the speakers already indicated, the last 2 evenings we've discussed trauma in children and trauma in the Black men, very great topics. Tonight discussing trauma in families. And here at the Trauma Center, we see trauma at a physical, from a physical aspect, but we know that the physical, mental, and spiritual trauma are all connected. We know that the COVID, for example, right now, has caused over 140,000 children to lose family members across the nation. A majority of those COVID deaths were Black and brown families. And COVID can not only, it also causes physical trauma in terms of being in the houses, not being able to get out, the trauma of children having to be on school virtually, for example, the trauma of intimate partner relationships being strained because of COVID and not being able to get out of the house. And that then manifests to the physical trauma. So some of the physical trauma that we see here at the Trauma Center include falls. Now, you think about falls and we think about it from an elderly perspective, from a whether it's construction or whether it's, children or all types of falls. But when we think about falls in the elderly, it's important in our community because we have so many elderly that also take care of our children. So when you have someone who falls and has a devastating injury to that fall, what happens to that family after that person falls? There's healing, physical, mental healing that has to take place, healing that has to take place outside of the home, and extended long stays, especially for example, hip fractures in the elderly when they fall, and they may be in rehab centers for a very long time. Another type of fall that we see, another type of injury we see here in the trauma center, of course, motor vehicle crashes, assaults and physical assaults from gunshot wounds and stabbings. We know that there's a whole plethora of reasons why there are those types of injuries in our community, especially in the Black community. We have a lot of work-related injuries and sports injuries. And we think about our young children who are so enamored with being in the sports world, whether it's football, basketball, different types of injuries. When those sports injuries happen to our families, it does put a strain on the families because not only are children affected physically, but sometimes our families are depending on that type of mechanism of sport that child plays for social outing and for other types of things. So we are mindful that all these injuries can affect our families. Specifically, when we talk about violent injuries, in comparison, in 2020, DC was at 165 homicides, and we are now at 168. We've already bypassed the 2020 homicide numbers, and much of those homicides in DC are Black young men. And so we think about the effect of that type of physical trauma on families. And we know that when a person is affected by trauma, you may see all types of behaviors that can make, of course, the family get the family to depart to different types of behaviors. So one of the things that we see are hypervigilance in families. Those are things these are behaviors you should look out for children, for families who may experience these types of traumas. Children or families who are quick to startle, bursts of anger, depression. These things are manifest before the physical trauma and after the physical trauma. So we'd love to talk more about what we do here with families and children as the program goes on.
Thank you very much, Ms. Hazelwood, for that information. I'd like to now introduce Ms. Martin, who is the Director of Health Relief, who is a nurse practitioner, to provide us with additional insights into the matter.
Good evening. Thank you for having me. My name is Shannon Martin. I'm a certified registered family nurse practitioner. I have 2 practices specializing in family medicine, as well as substance and alcohol abuse treatment. And we'll be expanding to behavioral health services just based on the shortage of behavioral health providers. I have one office in Glen Burnie, Maryland, and another one in Ashwater. With the pandemic, there was definitely a rise in behavioral health and psychological conditions. Typically, I'm there for medication management and also to collaborate, refer clients to therapists, psychologists, counselors. Some need medication management, some is just more so just counseling, someone to talk to. With the pandemic, it has been really hard trying to get these patients into services. So it's either, facilities are at full capacity. So, you have social workers, therapists, psychiatrists, psychologists who cannot take on any more clients. Insurance has been a big issue, whether, facilities have been accepting insurance or not. So I actually had to take on a lot of the mental health issues that my clients presented. So kind of doing a therapy session as well as, addressing their physical needs, whether it's for physical or not. So just talking to patients, is there some that come to me that have no issues with substance or alcohol abuse treatment? They just utilize their primary care for therapy and behavioral health because there's nowhere for them to go. And there actually was an issue, with telehealth being highly utilized during the pandemic, but you have a lot of patients who cannot cope with that change. They need that in-person one-on-one, the traditional face-to-face visit, and telehealth, just not having that same connection. So with that, I've been able just to hear a lot of things that we're going on now. It stems from childhood. So I have a number of patients who've been incarcerated for, 10 plus years with the drug and alcohol abuse treatment. That was definitely a rise, alcohol, especially among African-American women. And there's been so many podcasts on with the rise of alcohol misuse among African-American women. And this, a lot of time is leading to us taking on so many roles when a pandemic happened, whether it's financial, you're dealing with children are at home. Sometimes when you're in the house with your spouse now or your partner, that triggers up issues where, it just led to a lot of depression, anxiety, some PTSD. So it's now, just with the whole issue with it being limited access in underserved areas, I took on the part to expand my practice to behavioral health services. So bringing on therapists, counselors, whether it's psychiatric nurse practitioners or psychologists, psychiatrists to provide medication management for those who need it. And it's been, a big outcry for that. So I definitely, with all patients, I'm like, you just don't start misusing or abusing alcohol or opiates. Something stemmed from that. We're just not born wanting to do that. So a lot of times there are things that are suppressed that we don't even have any idea what's going on with us until you're able to communicate and talk to someone versus medicating it with medication, alcohol, or, substances, opioids. So it's definitely been a rise. I've been trying to collaborate with other resources, say, hey, I have a couple patients who need therapy. Also collaborating with other community resources for job placement. Right now, there's a high need for people in the employment sector. So definitely trying to get people adjusted and back on that. So it's definitely, an honor to be here to talk about that. Because, just me coming from experience, overcoming adversity and coming from a background of childhood trauma, I can really relate. But it's my job to show, others how I was able to, get through it, to, overcome adversity. So definitely a good thing to share and, be transparent and, kind of keep my title in the background when it comes to connecting with my patients and building, a line of trust.
Okay, thank you for sharing that information. I believe that, I just want to say I appreciate the information that you share because I think you provided some significant insights into what we are seeing in the mental health field. And a lot of the things that we took for granted as practitioners, right? The ability to connect via telehealth, the ability to have someone to transport you to an appointment, or the ability to receive services in a quiet environment. As a psychologist, I conducted or attempted to conduct lots of evaluations virtually and definitely took for granted that a person would have a quiet space, an independent, quiet space in order to complete an evaluation. And again, how we took for granted that a person may have the ability to connect via the internet on a stable connection. All of these things we definitely took for granted because of the pandemic. So thank you very much for sharing that information. The other thing that I definitely saw as a psychologist was this exacerbation of mental health symptoms as a result of the pandemic. So there were premorbid symptoms that existed, but the pandemic not just stressed the individual, but stressed the family system. And as Ms. Hazelwood talked about, the impact of having a sick family member, an ill family member, the death of a family member as a result of COVID definitely impacted the family system. So thank you all. I would like to now open the discussion to a question and answer period, so we can field some questions at this point.
I wonder if, ladies, I wonder if I could share some relevant data about family metrics during the pandemic. If that was okay in the context of a Q&A period.
Sure, please.
Okay. First of all, it's always a pleasure to be with the lovely ladies of the collaborative. Every time you invite me, I will come. You're beautiful, you're talented, you're intelligent, and that's enough for me to hang out for a little bit. What I want to do is I'm going to throw up some metrics here, so we can really begin to appreciate in some small part what this pandemic has meant to us economically. And because when you really talk about the pandemic and the economic impact that it's had on our community, we begin to understand that we started the game with a huge disparity in wealth, and that has just been basically challenged even more by the pandemic, and that puts us in even more precarious positions to do the things that we need to do to keep ourselves healthy. So this is a chart. By the way, I'm Mallory Williams, the trauma director, trauma chief at Howard University, professor of surgery, and it's, again, always a pleasure to join you. This is unemployment 2020 to 2021. And for those of you who know that means that it's the pandemic era. Okay, it's basically the whole era up until this date. Black people on this graph are the orange line, and white people on this graph are the blue line. And when you look at unemployment in the pre-pandemic era, that's that gray rectangle all the way over to the left, you can see that was a huge difference to start. Okay, and as we got into the pandemic, what you have seen is everybody's unemployment go up, but what you have seen is that Black unemployment went up higher. The second thing, and just as important, if not more important, that you see by this graph is that white unemployment dropped faster. Okay, that blue line is coming down faster than the orange line. And what we're talking about here in the modern economy is when you talk about a family, you really can't talk about a family without talking about a job and a way to provide for that family. So jobs are part of the social fabric, which enable us to get counseling, which enable us to have health care, which enable us to have safe communities, education, and we can go all the way down the line and talk about the things that matter in terms of keeping us sane and healthy. And so you can see that when you look at the effect of this pandemic on African-American people, if you look at the differences between the lines at the end of the graph and compare the differences of lines at the beginning of the graph, it tells the story. Those lines have gotten further apart and they have elevated. The differences are further apart and the consequences have been elevated. And so that talks about our economic health broadly. When you look here, this is basically saying is who's getting rich and who's getting poor. So when you look at the billionaires, they're the blue. And when you look at the workers, they're the orange. Now, every Black billionaire you can name, you can count them on one hand, okay? So it ain't but so many Black people in the blue box. It's a whole lot of us in that orange box in terms of the labor. When you look at what this graph is showing you is the money that has been lost by laborers as opposed to the wealth that has been gained by billionaires. There has been a huge transfer of wealth according to this pandemic. Just think if you own Pfizer stock at the beginning of this thing, or you own Moderna stock at the beginning of this thing, you have done very, very well. If you own the PPE company, or if you are responsible for anything Zoom or anything that has taken off during the pandemic. So we fundamentally, whether black, white, or brown, have experienced a transfer of wealth from poor working people or middle-class working people to very wealthy people in this country during the pandemic, and Black people are most represented by the orange box. When you look here, this is important because if you had high income before the pandemic, you were more likely to be able to work from home. Well, why is working at home important? It's important because you are more likely to protect yourself and to keep from getting sick, right? And so what this bar is showing you is that the likelihood of working from home in this economy was discriminated by salary. And there were more African Americans beneath the $75,000 to $99,000 salary than above it, which means they couldn't work from home and protect themselves, which means that even if they got the vaccines, they were more likely to experience breakthrough infections, even if they were vaccinated. That is a real impact because then somebody has to now take care of that family member, and that has a consequence on the household and the entire community. I like this because it gets back to what we said on the first night. I like what Pam Brown said. She talked about purposeful policies that kept people in predicaments of structural inequity. Unionization is one of those purposeful policies. There are all Black people who have done very well inside of the unions at Detroit and other places. But by and large, most laborers are not African Americans in unions. And what this graph shows you very nicely, no matter what sector of the economy you look across, whether it's the state government, retail trade, healthcare and social assistance, manufacturing, or leisure and hospitality, if you were a unionized worker, you were more likely to keep your job. The blue bars are losses from non-unionized workers. That's why you see the orange bars are much smaller, because most of them kept their jobs as opposed to non-union workers. And when you say union and you say non-union, I want you to think about Blacks being very ill represented within that union class when you look at it broadly across the country, okay? I love this because this is talking about low-wage workers, okay? What happened to workers when people started laying people off? Well, of course, the blue line represents our low-wage workers. They got laid off in big numbers. So that number that curve dipped all the way down. But if you had highest income, like Kenyatta, look at your red line. That red line stayed up there real high. All of these Alpha, Kappa, Alpha, Sorority Incorporated. That's that red line. They'd rather it be pink, but on this chart it's red. I'm sorry. Y'all on that red line, okay? Y'all all right. But this blue line going down here and dipping is problematic. And it's a whole lot of us is on that line. And that impacts a household. It brings uncertainty. It brings anxiety and mental health issues in terms of security. All of that can be found and reflected in the economic data. Now, we know that most of our frontline workers have been African-American and Latino. We also know that most of our frontline workers are female, they're women. And when we look at the difference between women and men in terms of occupying those jobs, we see that women were more vulnerable to COVID-19 because it was more of them in those frontline jobs working. Now, what does that mean for the Black community? Well, if you got our women on frontline in these essential jobs working and they're vulnerable to the virus, Who's going to take care of the kids? Who's going to make sure people get to the doctors on time, pack the lunch, clean the house, make dinner? I can keep going on and on and on because I can tell you who ain't doing that stuff. Okay. Now, this becomes a structural problem because now the cornerstone of our community, the Black woman, is the most impacted or potentially impacted element in our community in terms of how the virus is transmitted. So if I was making policy inside of the African-American community alone, African-American women would be vaccinated first, because this graph right here shows, right, that they are in the vulnerable positions, right? So if I was making policy for the hospital, trauma surgeons would be vaccinated first because we're the most vulnerable. This is important because it really shows that women of color are most likely to have stopped looking for work. What happens once you've been unemployed for so long that you're not even looking for a job anymore? What happens to substance abuse in that house? What happens to alcohol use in that house? What happens to child abuse in that house? What happens to intimate partner violence in that house? What happens to hope in that house and belief in that house? You see Black women here represented by the, I don't know why they didn't put Black women as the black line, but they put us as the red line on this chart. We go again. And you can see we are the highest line on that chart as it relates to having stopped looking for work, okay? That is important because that now it's not even an opportunity to get back into the economy based upon those behaviors. And then we see the difference between mothers and fathers, which we know, okay? When we start talking about mothers with one child versus mothers with two children, we see more of the mothers stopping working versus related to the fathers. And that is important because when you look at economic gains in the Black community, women tend to be higher earners in their households than men. Okay, that's a reality. And the problem is that the Black church and other people ain't taught Black men how to deal with that reality. But the percentages show that Black women are making more money in the households than Black men. And you got to be secure enough in yourself to deal with that and be still very productive as it relates to a bedrock of your household. So those data that I shared with you begin to paint a broad stroke of the economic headwinds that have hit our community as a result of this virus. And I'll be happy to participate in any further discussion. Thank you so much for letting me share that.
Thank you, Dr. Williams. Ms. Martin and Ms. Hazelwood, have you seen a rise in the number of Black women as clients requesting services?
I'll start, yes. And, to piggyback over Dr. Williams. Yeah, absolutely. And it's just for basic healthcare. And it's more so just the stress that has been put upon women, just kind of dealing with COVID and playing so many roles, so many hats with the pandemic. That's definitely has been an issue, but I can't say specifically I've seen an increase in women who are the head of household or the breadwinner, because not only are you dealing with, the challenges at work with trying to adjust the changes, that the system set aside is due to the pandemic. A lot of them now are having issues in their marriages. So it's now, they're playing a different role, and you have the partner, where there may be, some issues with them was now this person's the breadwinner. So now you're dealing with emotions, from a male, who's not able to express it. He has no clue what's going on as well. So now, to the point, okay, I just want to get out of the house. I don't want to be a mom right now. Just me coming to the doctor's office and sitting in the car is giving me a break, just from the emotional, things I have to deal with at home outside of being with these kids all day while I'm trying to work and they trying to do school. So depression has been a big thing with it, where more so you'll have kind of, my African-American clientele kind of pushing away from medication. Some of them that, look, I need Zoloft or something, to help me cope, something to help me focus. I need Ritalin, I need Concerta, because right now I'm all over the place. So I definitely have seen a rise in that, and it's definitely been from mental health and just, stress. Now it's the weight gain. They don't understand why they're gaining weight, why their hair falling out. They're doing all these lifestyle modifications and can't seem to lose weight, not sleeping. And it's nothing physiological, it's actually psychological that's dealing with them. Okay, let's look at your thyroid, let's look at your cortisol levels. Everything's coming back normal. And now we're getting to the point where mentally, how are you doing? What is your stress levels, your environment, finances, all the, issues that you had to take on, with the pandemic on top of what you were already dealing with before the pandemic. So, now there's a big cry and I see a big influx among the African-American community for therapy and counseling, and especially among my men. That's the stubborn group. Like, nah, I ain't talking to nobody. Now
That's
they're
right.
like, hey, I'm all right with going, but it need to be somebody to understand. They got to come from where I come from, the way me and you talk. So, even if I can help one person, it's good, but just knowing that there's an increase for people who are willing to go to counseling and therapy is good. But now you have this upside where it's limited resources. Because, people are at capacity, or, they're pulling out from employment because they got to deal with other things, or, then they're overworked or overload because now they have to take on so many other clients and, especially deal with their own things that they got going on.
Thank you for that, Ms. Hazelwood.
Absolutely, I agree with Ms. Martin. From the physical aspect, I'll tell you the story of a recent mom that had a son that experienced a devastating injury, and he was a victim of gun violence. But he was in the hospital for quite a few weeks, spent his 16th birthday here. And this mom is a mom of six children, and he and his brother being the youngest. But I have sat and talked with her many days, and we talked about, she couldn't work. She was here with her son all day, and who wouldn't be with their children in the hospital all day because she wanted to be here, right? She didn't want to leave her boy here. She had a family that had all of her kids were there in the house for the most part, all had COVID except for 3. So she was fighting the battle of making them get the vaccine where she thought they should, and some didn't. So she was fighting that battle. Then she was fighting the battle of him going back to school, right? And one brother being in one school and one being in the other. And then in this environment, how she couldn't get any virtual schooling for her son because they weren't offering that at her school. So it, she was paying, even just paying for breakfast, lunch, and dinner every day because she wanted to be here every day. And then having to take her son home with this injury and care for him. And the type of injury he had was definitely not just a major physical injury, but a major mental injury especially for a 16-year-old boy. And so I think that sometimes we put on a good face, meaning we as Black women who are often the, as we've already heard, the financial backbone of the family, the physical backbone of the family. And we keep going and we don't stop and help ourselves. So I think in terms of making sure that our families are okay, that it's important that we have to take care of ourselves. I think that we have to remember some of our deep breathing exercises. I think we have to think about validating the experiences that we've already had that can cause us to be where we are. I think about focusing on positivity without dwelling in the negativity, and also seeking professiontional help. It's been such a stigma in our communities, not just for our Black men, but for Black women too, and for our families. Specifically, this mom was saying, but what would that do for his schooling? Because we definitely wanted to refer him to mental health services. It's just like, yeah, but what is that going to do for his school record? And that's a real thought for these families. So I think that from a physical trauma perspective, remembering that it spills over into every aspect of our lives, financial and mental. And again, the long-term care that goes on with physical trauma can be quite financially taxing and mentally taxing on a family.
Thank you for that. Before we move to questions, I'd like to both of you to weigh in on this stigma that you all have both discussed about mental health services, especially in the Black community. What is your message to the Black women, the Black men who say, I don't trust medication. I don't trust psychotropic medication. That's not how I was raised. I don't believe in that. What do you say to those people who are quite leery about taking a medication at this point?
I'll start with that. I can be I'm very transparent as a provider with my patients. So when you hear that, it's kind of just telling them, hey, let me show you all these side effects that's on this ibuprofen insert and this Tylenol insert. And they're like, okay, you got a point. So, and it's, but I'm straightforward, with medications for psychological mental health conditions. A lot of the side effects have to do with something mental. So whether you're having nightmares or, increased depression. So I kind of just talk to them, hey, when you start this medication, give it about 2 or 3 weeks before you feel, try to evaluate whether it's working for you. However, if you're having any issues where you're having worsening depression, suicidal thoughts, let me know ASAP, call the after hours line, but it's more so I had to be, transparent with myself. I had to be on, antidepressant before, when I had postpartum. And it wasn't enough prayer or therapy in the world that could get me through what I was going through because it was all hormonal. So at nighttime, in December, having my daughter so late, this is 6 years ago, I was going through a tough time once that sun went down, just dealing with, obsessive thoughts of actually hurting my daughter. But when I say I was calling everybody in my phone book, I need you to come over here because something ain't right with my brain. And, my husband, it's just your hormones. No, this is not hormonal, but the difference with me is I said something to someone and I was able to communicate. But I think a lot of times we hold things in because of the stigmas associated, whether you feel like you're crazy or you don't know what's going on. So the best thing is just to talk to somebody. So I try to get people into therapy, whether you have a problem or not, you think you go to therapy, only when there's conflict or there's issues going on. I go myself for maintenance. So, my staff know, today was my therapy session at 12 o'clock, close my door. It's lunchtime. I am having my therapy session. So that is my lunch. And even with me, going to therapy, I'm able to identify stuff within my children, my husband, friends. It teaches me how to deal with it as well and look for signs and symptoms or my own behaviors, how I may respond. I'm learning, hey, when this is said, respond as this way. This may be a little bit more positive. So just being transparent with that, like, hey, I was in your shoes at one point or not, or, have someone close to me who was, I think, just being open and honest and, not keeping all your skeletons in a closet. Sometimes you got to bring those out, to help someone else.
I appreciate that insight. Yes, Ms. Hazelwood.
Absolutely. Ditto to everything that Ms. Martin said, but we also, I think, managing their expectations that you may or may not need medicine, but let's start from somewhere. And even if it isn't that you're talking to a professional, who can you talk to? What can you talk to? Can you jot down a few things? And sometimes those small baby steps may need to lead to medication, but just getting them in and helping them understand that if you don't talk to someone, these are some of the consequences that can happen. And I think also, having a daughter, I find myself sometimes reiterating those same thoughts that I was raised with, like, okay, you have to be strong, you don't have to do this, correct, So I try to catch myself and break that cycle. I try not to use the word crazy, for example, just so that we don't hear that word and associate that with some negative thing, and help her to understand that you can talk to someone. And I think some of these figures that they look at, these famous people who have indeed done that, are examples of how, we may need help, and it's okay.
Yeah, I think that let me just say this from a masculine standpoint. Why are you laughing, Kenyan? She fronting on me. I ain't said nothing yet. See how y'all do us? See, listen, so right, a part of black men's masculinity, a part of men's masculinity is not having to take something to be more man, right? And I know that's hard to understand, but black men are not into having to take a pill to be more of anything, right? So there is this thing that, if you're not self-sufficient, if you're not, 100% man based on how you came out, then you something else. And then that gets you into that whole delusional type of thinking. And so the question really becomes not one of how does going to see a counselor become okay in the black male psyche. That's how we deal with it. That's the frame in which we deal with it. But that's not the issue. Okay, that's the result of the other issue. Okay, the question is not why is it that taking, whether it's your diabetes medicine or whether it's any medicine, psychotropic medications is appropriate or not appropriate for black men. What the real question is how are black men allowed to be weak in this society and still be whole, right? And the reality of it is that until we find safe spaces where black men can be weak, we ain't going to no counselor and we ain't popping no psychotropic pills, because we have a problem with not feeling safe in our vulnerable spaces, right? And so I think we've got to really begin as a community to try to find the space for men, black men particularly, to be vulnerable, okay, and it be okay. Okay. And that starts, ladies, at home. That starts with you seeing something that ticks you off to no end and choosing to say nothing. That doesn't mean that you have to ignore unacceptable behavior. That means you have to understand the context in which men can be wrong, vulnerable, and be safe. In other words, there's a time and a place. You guys know that. We don't have to draw a picture for the situation, right? If for the last 7-10 days, I can guarantee you two things. We done something wrong, and you done told us. Okay? And so you got to understand, coming from out, if they're going out into the world, right? Ain't no missteps for black men in the world that's not being corrected, okay? There's no mishaps that we do when we leave our door we're not being checked on. So if we're being checked on it 100% outside the door, and then we come inside the door into the home, into the safe space, and we're being checked on it, where are we unchecked in the society? Okay, right? We just in jail. We're not in a physical jail, but we're in a sort of emotional jail where every place that we exist, live, and breathe, we are critiqued. You're not going to get us to go to see a doctor. You're not going to go get us to see a psychologist, and you damn sure ain't going to get us to go take some medication if we're still operating with those facts in place. There's got to be a space that says, baby, no. We right here, you safe right here. You ain't got to be whoever you got to be out there, but there is a zone and a space, even if it's just an hour a week. Because I know this is hard for y'all. But even if it's just an hour a week where we get a little space, and I prefer if you put it on Sunday when they watching football or they basketball game or something, you got to define a safe space for Black men in this world. Because right now there is not one, and that is problematic.
Thank you.
I love y'all.
Miss Martin.
Dr. Williams, you have you cracking up.
I love you to death.
Yes, I agree 100%. And it took me to go to therapy to learn how to be quiet. So sometimes you trying to
time to stop this webinar.
I had to learn what that means to be quiet, to keep a certain facial expression. And at one time when I was going to therapy, it just looking at those screening tools and it's tips that's used, there may be some statements that I may say, not knowing that it feels disrespectful to a man. So it's not even coming off with an attitude. I may be like, well, hey, I say that to my girlfriends or ask them that in that way all the time, but it's interpreted and it's perceived differently from a man. And I'm not no man, so I'm not going to feel, but getting that professional help to understand that helped a lot. So I knew when, okay, certain things are triggers based on, maybe my husband's background. So how to avoid those things. And a lot of times when you have someone that's resistant or doesn't want to do certain things, I got to focus on me and get therapy to learn how to adjust with someone who doesn't want to go to therapy, because you still got to be in that same household with them. So you're going to need your own therapy to figure that out. So yeah, just being quiet and not saying nothing, that is probably the hardest, simplest rule for us women. But it's highly effective, and it shows a different, it sets the tone for a different environment as well. But I did have a question, Dr. Weir. So I did notice that a lot of men, they have to get to, the wits end before they would even consider medication. It's like, hey, if I go home, a girl throwing me out, without me having an appointment card saying I'm seeing someone. So I know a lot of time with men, it have to learn through experience, and it has to be that life or death part where it actually, they'll go out, you try to prevent that, but sometimes that's the way that they operate. But I did want to stay on track. I did have a question. So with the unemployment, so right now I'm in this Goldman Sachs small business program.
Sure.
And we are having a tough time. I have a lot of my peers in the cohort, they're all business owners. A lot of them are hiring. But right now it is difficult getting employees and quality at that. So it's like you see this high unemployment rate, but then I'm seeing so many signs out. I think I saw a fast food offering a $500 sign-on bonus, and, even with me, I'm hiring, I like Chick-fil-A service for my staff to offer that, but it's hard, just finding employees. I just recently returned from New York. I was in upstate New York. And, the hotel I was staying at night, there was only 2 employees in the whole hotel, the front desk clerk and security. He said, we don't have any evening housekeeping. I see some people, it's, $50K plus a year. They can't find employees. So, kind of want to see if you can give some insight on to what's the issue with that.
Right.
As far as, especially small businesses trying to get employees.
Right. Right. And so what we've had is a contraction in the labor force. And that contraction took place because businesses had no revenue because of precautions from the pandemic, social distancing. Right. When you contract the labor force so fast like that, then what you have is people dropping out of the labor force. So you may have, so if you got 100 people and you fire all 100 people, 20 of those people are going to drop out the labor force. They're going to stop working, which means now when you re-expand the labor force, you don't have 100 people to hire, you have 80. Okay. All right. So that's why I showed that slide about mothers dropping out of the labor force. Now let's connect that to contemporary times. We got 2 bills in the Senate and in the House that we're working on for human infrastructure and physical infrastructure, right? A lot of argument about how big one should be. Should it be 1.9, 2.2 trillion, 2.2 billion? Listen, the reality of it is, if you don't deal with child care in this country and the cost and the expense of a child being cared for appropriately while a mother is working, you can't re-expand that workforce. And that's what I've heard Nancy say that, I've heard Speaker Pelosi say this, okay? If you don't deal with the child care issue, you cannot re-expand the workforce, because the most eligible workers who are going to work consistently, stay in the workforce and be faithful, are going to be those women who have left, who are dutiful mothers right now. And so the reality of it is that contraction, listen, here at Howard, we contracted. And guess who we contracted with? We contracted our workforce, and the people who we let go were nurses and nursing assistants. What happened to those people? You know what they did? They in New York, El Paso, making about 1.5 to 2 times the amount of money that we were making at Howard during the middle of the pandemic. They're not in the labor market anymore for us to go back and hire, because other people saw need in them and then gave them more money and then drew them out of reach. The other thing you have going on in this pandemic that is the least talked about thing right now is the huge labor shifts. People are moving and working. So one of my team members left here and gone back to Minnesota, right? From DC to Minnesota. Well, you got nurses leaving DC, going to more profitable regions of the country, working during the pandemic. Those are labor shifts, so that the numbers of people who are working in certain regions are changing, but they're not changing gradually as they would usually do in the economy. They're changing acutely by a lot, okay? And now you're trying to build the economy back up. You're trying to open up. Your employees are hired by somewhere else, and some of them are being hired by other people who are not even in your region. So it's not like you can compete to bring them back because they're local. So that type of labor force shift and tumultuousness is going on right now, and I don't see that being solved anytime soon, right? Because you got all these restrictions on who can work, right? So if you've been to jail, you got a misdemeanor, you got maybe a felony, that limits what you're going to be able to do in the economy based upon how we are structured now. In other words, we only rehabilitate our incarcerated individuals to a certain reentry point. They can't re-enter higher. That's a structural problem. That's a purposeful policy that keeps certain people in certain positions, right? Because if you rehabilitate somebody, they should be able to re-enter the economy at any point that their achievement takes them. That's never been the place. That's never been the situation with the carceral state. Perhaps we will get there because of the labor shortages that we're having in key areas, because it's also messing up our supply chain, which is driving up the cost of goods and services at the store. It's a great question.
All right, I'd like to open up to some questions for our panelists. Do we have any questions?
And yeah, I want to know from mommies. I want to know what do you tell your children about what's going on? How do you explain this madness to them? Because it is madness. I mean, through a child's eyes. I mean, you know, are we actively telling our kids anything particularly, or are they getting it off MSNBC and YouTube?
Well, I think in terms of trauma, we are, I definitely give my daughter messages for physical and safety, whether it's something as mundane, like going out in the street, or even with her private parts of her body. We talk about all of those things in terms of trauma and make it very real, because kids, as I said yesterday, aren't kids anymore. They understand things way more than you think they know. And in terms of the pandemic, she is in a school where they are testing every week. She's in a school with other people who are excited about the vaccine. She's had friends in her cohort who have actually participated in some of the local children's national vaccine trials. And yesterday, when she got her flu shot, she actually thought she was getting the vaccine. She was very excited about it. But she, obviously I was able to tell her, but she is actually anticipating, even at her young age, to get the vaccine, because she doesn't know that the words vaccine aren't synonymous with COVID vaccine. She just thinks vaccines. And so that's because, we've chosen to be vaccinated in our house in terms of COVID-19, and to try to protect other people. And so from it, we try to give her really good, solid, consistent messages from the two people who she sees the most and who love her the most. So I think consistent messaging is really important, not talking to them and giving them real examples, not talking to them necessarily in baby talk, but helping them understand the consequences for when we don't do, not just not get vaccinated. We know that, but having good choices, making good choices. You can't run out in the street. You can't do what your other friends do. And so trying to help her learn at an early age that choices will change the trajectory of your life. So that's important for us.
What was her perspective when we were running? We went for a week in this country where we were talking about COVID being problematic for hospitalizations in children and children dying. I mean, we went for about a 2-week period in this country where every time you looked on the TV, they were talking about the Delta variant being a problem in children and them being in hospitals. And I'm kind of trying to figure out, well, aren't we scaring other children who are not, by the way, who are not eligible to be vaccinated if they were under age 6, right? So they couldn't be protected, and they saw these shows about these other children being hospitalized and not doing well. I was very concerned about that. Thank God that Pfizer's study, the preliminary data out on Pfizer's study now is demonstrating efficacy in the Pfizer vaccine in lower doses in children that are under age of 6. So we may be nearing the EUA with regards to that, right?
Ms. Martin, can you chime in and talk to us a little bit about some techniques that you think we can use to deal with trauma?
Yeah, from, just from a personal standpoint, it's just taking care of yourself and getting outside of your regular routine. I used to be kind of so structured in my schedule because, my mind goes all over the place. But I mean, I don't, that's not recommended. It's been a time where I had both of my children not go to school that day. Hey, we're going to do this. And, whether we're out, it can be, finance is the issue. We went to Home Depot. I bought some seeds and a dollar store pots, and we were just out in the backyard, like just planning stuff. And, me just talking to them. I had my little speaker on, which I want to hear. So it's just seeing me in a different element, not that work, mom mode. Is just different. And, my son is 11. He's very mature. But just, I noticed he's talking to me more, about more personal things. I'm like, you talk to your father about this, but it's just him even just being comfortable about talking to me and just not having my first thing be a reaction. It's just me listening to him. Because you're going to hear it out in the street. So, if you want to talk about it, I'd rather you come and tell me, or talk to me. So it's all about self-care. I have to take care of myself. So sometimes I travel pretty often. I know some people are like, oh, well, where the kids? They with their father, they with my husband, So I know with some women, it's just, you have a hard time letting go, like letting the kids stay home. You call and worry about the kids. Okay, they're not going to do everything like you. And I'm like, if you walk out that door and say, look, I'm having a mental health breakdown, trust me, he's going to take care of them kids. So, they're not going to starve. They're not going to eat the same thing that you will cook, but it's just getting out of your element. I had to tell one of my staff members, I don't know, last time she took a vacation, but she just went to Jamaica last week. I'm telling her, take a vacation. You got to leave, use it. And that was the first time in years. And she was like, it was the best thing I could have ever done. Just having quiet, not being around my kids, not hearing this all day. She was like, it just felt amazing just to be in a different environment. So, recently we went call it glamping. It wasn't really camping, but we all rented RVs, a couple families, and I ain't never been camping. I come from the street, so that wasn't even a term at all. But my kids enjoyed it. It was something different outside of the culture. It just made you just appreciate, just being outside more. It wasn't no technology. I didn't let them play any games, and they loved it. So it reminded me back in the day, we go outside and jump double dutch, come run in the house and grab a piece of cheese, drink some water, outside of the bathroom sink, because we didn't want to be in the house. Only time I was in the house is when I was on punishment. We couldn't go outside or playing, a Sega or Atari because I'm on punishment. So it's just trying to, adjust to that and just being transparent and talk and have you a network. It can be one person. You don't have to have a whole bunch of friends, but one or two people that'll keep you accountable. And sometimes I'll say that to men too. And I get it, men, there's definitely resistance with that. But do you have one male to talk to? If you were to die today and at your funeral, outside of your mama and your girl, who can speak for you? And if you have out of those two, you have nothing to say, you might need to find one person who you can talk to, who you can trust. So I say the same thing for women. And you'll hear women, well, I don't trust other women. How you not trust other women or don't like other women and you're a woman? So maybe consider your environment. Are you the common denominator why you can't get along with other people? So just really having, that one focus, that one person, that can actually hold you accountable and can take you places, not someone where y'all all on the same level, nobody's going nowhere. With me, I got out of my places because I talked to somebody, who was different than me. And I'm like, okay, I'm just used to Southern PG County, never been to Bowie, never been to Laurel. So it was just a different environment. So just get outside the box. So that means just going outside. If you last time you planted a plant when you was a child, try doing it again. You would never know, what you like to do, especially everything doesn't have to cost. So, letting your children be in that environment as well. If their bedtime 8 o'clock, look, we ain't going to bed at 10 o'clock at night because we're going to go outside and do something, or we're going to go down and play this game. So I think just kind of getting out of your element and not worrying about so much. If it ain't emergent, if it don't have to be done within 24 hours, see how it feels just to not get it done. And, you'll still live.
Yeah, I hear you talking about this reevaluation or restructure of some of the formats that we've constructed in our families. And I hear you talking about empowering children. And, I'm wondering about the pandemic and the impact of having to force children to adhere to all of these guidelines. And do you think that it's caused our children to be desensitized to the point that they will accept anything? Do we need to start having more conversations with our children about empowerment and instead of this feeling of hopelessness, this feeling that these things are being impressed upon them? Any thoughts about that?
I'll comment just putting them in the midst of it. So I have taken my daughter and my son to work with me before. And, I had to pick a day, a certain day, but just them being able to talk to other people, to hear other people, it's, to see me doing COVID tests and, doing antibody. My daughter's 5. I had her go on line and I did an antibody, was a finger stick. She was crying at first, but then after this one little poke, after a second, she like, oh, okay. So, okay, let's go online. And that's the thing that they want to do. Technology is social media, everything. But she went on there, it was like, hey, mommy did the body shot and it was fine. I had them do COVID testing. So it's just kind of getting them into the element. So I would a big support of that bring your child to work. So, unless you don't like your job, you cussing people out at work might not be the environment for them to go into. But just them, just being accustomed to different things. I think that definitely helps. And I just talk to them, and I don't make my children, have to adhere to what the social media or what everyone says. So I told my son, he's old enough. If you don't want to go to college, that is okay with me. But you're gonna have to have a plan B. I'm all for trades. So I'm not stuck into this element where you have to do this and you have to do this. College ain't for everyone, and I'd rather you not waste my money if you don't want to be there. So, but just finding what they like. So there's a lot of apps that are free that you can use, and it can assess your personality type, your children's personality type, your love language, their love language. I know some people are stuck with, they have a job, but they feel like they ain't doing nothing. It's no passion, there's no purpose there. But I'll recommend a few apps that people can go on. And it's like little questions that you can do. And it may do your own self-assessment, like, hey, this is who you are. This is who the type of child, the type of personality that they have, and have activities that are suggestive, to meet the needs, to help you feel a little bit better.
Ms. Hazelwood, any thoughts about empowerment as it relates to children and the family?
I would say again is having that foundation for communication so that they feel like they can come and talk to you, because they do, in my opinion, internalize a lot, and children are constantly worrying and thinking about what other people are thinking and things. So it's important that I think having a time to talk. So we have a 5-minute time to talk and mindfulness before bed every night. And anything that I, as a busy mom, have not listened to, anything that she just wants to say in that time, she'll tell me about all types of things. So building a foundation of communication, and she now uses that for when we are doing other things. She's like, I'll tell you tonight at our time to talk. Okay, that's fine. And so building that communication for children, I think is really, really important. I like to say too, when we talk about trauma for families and that financial piece, what Ms. Martin said about trade schools, really important that some of our schools get back to partnering with our trade industries to offer those vocational programs in our schools. That can really propel a child out of bad choices, a child that's vulnerable and maybe have gotten in trouble, and now they're kind of like, okay, I want to be on the straight and narrow, and they need something to do. For the child that's not as motivated to go to college, and it gives them great livelihoods, whether it's some type of babysitting or hair or plumbing, electrical. I am all for the schools reincorporating that into the programs. So that I thought about that when you said that.
Just for the sake of time, I want to circle back to this idea about trauma, and I want to just provide some education for the parents in regard to symptoms. So if you can help a parent understand, what do they need to be looking out for? What kind of signs do they need to be mindful of in regard to understanding when their child is struggling with anxiety or being impacted by trauma?
So some of the, I wasn't sure who it that was addressed to, but we can talk about some of the signs and symptoms we see in terms of physical trauma. We will often see children and families who are have depressive-like symptoms. So they may not be talking, they may be bullied in school, they may have other types of behaviors, not eating well, not sleeping well, not being able to communicate. They may be exhibiting certain behaviors sexually, and other behaviors that are unlike what you are used to seeing. And those types of things should concern you right away. You should definitely seek attention seek help from a professional like Ms. Martin as soon as you start to see these symptoms. You should document them. It's important sometimes when we go into the physician's office that we even have somewhat of a log where we can tell the healthcare provider, these are the symptoms I'm seeing. This is when I see it. When is it happening? I'm seeing this after school. I'm seeing this in the morning. Are they hypervigilant? Are they quick to startle? Do they have certain bursts of anger that you may see in children or families in general? So while that may be more specific to children, it's also specific to moms, to dads, to anyone in the family. When you see them exhibiting those symptoms, it's important to reach out right away to your healthcare provider and or to your local crisis center. Sometimes I think that when we talked about stigma earlier, some people may think that you have to call a psychiatrist or psychologist right away. There are other steps before you get there. You can definitely call a crisis line, which you can easily Google and find the crisis line for your center. And now crisis lines, not only do they have people that can talk to you, but they have people that will come out to your house. And that's a really good resource when you are exhibiting these types of behaviors.
Thank you. Ms. Martin.
Yeah, Kenyatta definitely said a lot of the comments, and some I noticed you can have complete opposite symptoms, but it's the same thing. So if you have a child that's very clingy, don't like to be left alone, that can be a sign, especially when that's not their normal behavior. Whereas now when you're walking out the door, they're clinging to you, but then you can have a child that don't want to have anything to do, just social isolate themselves. So sometimes we have teenagers, they're just being a teenager, that's what they do, or preteen, but it can mean something else. So you can have a child that's coming home crying, they're being bullied, that can be trauma, but then the child who's doing the bullying can also be experiencing that trauma. Because, I noticed, kids with trauma, it's a lot of control. So they can kind of be very controlling So it can lead to bullying, or, you have the young men who may be in relationships and are very controlling over the girls, and vice versa. So those are kind of like some things that you can definitely identify that's not, your classic textbook where we would think, okay, it's just a phase that they're going through. And it's sometimes a cognitive issues, we're quick to put that thing, well, they're just hyperactive, or they just can't catch on to the curriculum, or they can't learn well. It may not be, ADHD or ADD. It may actually be trauma, and they're having a difficulty processing in an environment where, the brain structure is not there because they're dealing with trauma.
Thank you for that. Dr. Williams.
I have to remember when I'm muted. One of the things that's interesting is that, I'm a Scrabble and a Monopoly household. And I try to force myself to engage in games that I always win with children, right? Now, I want them to get better, but I'm not going to go easy on them. I'm not going to let them win. It would be interesting to know, in all seriousness, how digital devices have taken away our family time in substantive ways that used to exist in our homes. And I think the games are fundamentally good tools to interact with children, right? So they're young, you play that little life game where you roll the dice and you march around the mountains and whatnot and get all this stuff. And as they get older, then you graduate the sophistication of the game. But it would be interesting to know, from my perspective, how our communities have interacted with children, even as we've had more time to interact with children. How did we utilize that time? They needed it. They did. Because everything we know about children says that when there's crisis, they need to be in school, and they didn't have school, right? So the first rule of thumb is that if you got a mass disaster, you got a crisis, reinstitute normality for children, and normality for children means sending them to school, having them interact with teachers and their peer groups. Well, they didn't have that, and there wasn't really a equal filler for them. And I think that it's only compounded by, when we look at the public health messaging during this pandemic, has been semi-horrible. Been real big on masks, been real big on social distancing, but it hasn't really, for all of America, broached the subject of how are we going to come out of the pandemic stronger? How are we going to come out of the pandemic more literate? How are we going to come out of the pandemic with more books read? I mean, this was an awesome opportunity for children to read, right? How many of our children took this opportunity to improve reading and math skills? It's an awesome opportunity to improve family skills. How many of us had the time to do that? And where are the public health messages, be a billboard or on television, talking about the pandemic's ability to give us something that we never had pre-pandemic and probably won't have post-pandemic, and that's time with each other, right? And so the previous two nights when we've dealt with trauma, we always got down to the action item, right, of the panel, right? What was going to be the healing potion, as Sean would say, or the healing emollient, I forget the word she used, but one of the things that we've got to do is we've got to fall in love, not just with ourselves, as I mentioned 2 days ago with the men, but we've got to fall in love with this notion that as the world has slowed down because of the pandemic, we've got time to do things that we just didn't have time to do before. I think about how much I traveled, how many planes I'd be on, and how all of that has slowed down because of the pandemic, and the places that I would be at, and then now I'm not, we need to harness that for a specific purpose. And I would propose that one of those purposes would be our interactions with family, right? And that it should be easier now to do that. I think that's very, very, very important. I think that's from a public health standpoint. It doesn't solve all problems, but it does give us a place to understand the problems, if you will. And that's what I would say. It's always a pleasure. And I got to tell you guys, it's always a joy, even after a long, hard working day, to come into this forum and to engage you ladies in the way in which we engage in terms about the sincerest intentions for our community. I think that's important. I think that's the fact that it happens is important. The fact that people see it happening on the Facebook medium is also of great importance to me, because I think we don't do enough of it, right, in small groups like this, and really just begin to understand the little things that we can understand about each other and then operate in our own space and faith to make things better. So I can't say enough as the trauma director of the Level 1 Trauma Center at Howard, how much appreciative I am to be in continual collaboration with you guys. And then we're gonna get that relationship seminar going, and then that's gonna be off the chain. That's the future. But I am so pleased and proud to have been with you all for these three, to share this time with you outstanding ladies for these 3 evenings.
Thank you so much. Ms.
Oh,
Martin,
you're so welcome.
we wrap up our comments for the evening.
Yeah, a lot of people know I'm big on transparency. So I think sometimes when you're presented in a way where you can't meet people where they are, I think that's a big thing. So, I tell people we this DMV area is kind of like a bubble. But when you go outside of these outskirts, you're not seeing a whole bunch of these faces that you think you're seeing, especially in the work industry. Just with nurse practitioners alone, you got less than 9% of Black nurse practitioners. But we're not used to that because we're in this area where it's heavily populated with successful African-American people. But when you go out, it's like a culture shock where you have one Black family here, the next Black family is 20 miles, away, and they're the chocolate chip, among their community for real. But I think, all of us, a lot of people who in behavioral health, a lot of us have been through things. And I think people who really have that passion, whether it's psychiatrist, therapist, counselor, we all have suffered some type of adversity or trauma. And sometimes it really takes us to be comfortable to disclosing that to some, of those that you help, whether it's friend, family member, client, and just building that trust. And so it's not like, hey, you're talking to Shannon now. You're not talking to, 8 years of school. And I don't care about that. That can be taken away from me at any time. But it's just kind of us, bringing some things that's within us out to help others. How do we overcome certain situations to be where we're sitting in this chair now? I'm pretty sure, there's someone on this panel that's suffering from depression. As soon as we click off of here, you got triggers. Now you're thinking about this, it's nighttime coming. That's when, a lot of mood suppressors around that time. So really for us to, grab a hand, for us to talk to someone and bring someone in to help them out and help get them where we are. I'm big on bringing our young men and women up, whatever they want, as long as you're going to put in the work. I can lead you to water, but, you can't make them drink, but I will pull in anyone, especially from low income, underserved. If you're willing to put in the work, I will give you all the resources that you need, and they free. And also just going on Google, if you have access, it can go on Google, hey, something fun to do today. And it'll be so much stuff that come up. It's free. Anything I think of, I'll be on Google, how, when you're doing this, why am I responding this way? And so many articles can come up. It'll give you resources, certain free apps on the phone, because, we're in a technology world now. So especially with these young people. So just doing something different. You know, if there's resources, you don't have to have money for everything. But it's a lot of things online. You can just Google it, just ask someone, you know, just look at your environment, you know, who you hang with, you know, find someone who's not like you. You know, meet someone new, and you never know the places, you know, that you'll go or the resources that you'll be exposed to from that.
Thank you, Ms. Hazelwood.
I would just say what I'll put in the chat, which I also have here in my office, which is a little mnemonic from the Crisis Stabilization for Safety Aids, and it says the scope. So when you're feeling like you're in a crisis situation, or you are experiencing trauma, or maybe you're about to do something that you hope will regret, or such, that you stop and you think about what you're going to do. So the scope, the S stands for slow down. So you want to slow down and take at least 10 steps away from where you are. And then the C for connect to your body. And at that time, you want to really just touch yourself in a mindful way. Feel your hands to your ankles, to your arms, to yourself, to your body, and be able to breathe. And then orient. So slowly look around and notice the things around you. And this is kind of the starting practices of mindfulness, if that's something you care to practice. And then pendulate. So notice anything that would put your mind at ease around you. And then after you've done all that and you have settled down, start to engage back into talking to someone, talking to people around you. So just something to take with you when you are having those feelings of stress and trauma. So I really appreciate having this conversation, and that you all continue to do this series, because it's so important. And each time we find out something different, not just about myself, but about other people and things that they're doing. And we don't often talk about trauma in an open forum. So I really appreciate you all doing this. Thank you.
Ms. Shannon, Ms. Kenyatta, I'd like to just thank you on behalf of everyone joining us and the rest of the people, your genuineness and your candidness about issues that we as a community never like to discuss is so very appreciated. And I hope that the message that you delivered was that there are supports, and it's okay to receive those supports. And Dr. Williams, we thank you as well for your insights, particularly about Black men, and how important it is that we never forget your voice and how invaluable you are to the community, to the world, to the family, and to our family system. Again, thank everyone for joining us this evening, and we hope to see you again at our next event. Good night.
And we got to have all the members of the collaborative come to DC and have some lunch with us.
You let me know when.
Let me know. We got to have us some lunch.
That's right. That's right.
That's right. All right. Thank you, ladies. As always, look forward to seeing you again.